Good afternoon, my friends. Happy Wednesday. The doctor is in the house. Welcome back to another episode of To Your Health with Dr. G on this great Wednesday. My name is Dr. Mark Gomez. I'm a board-certified internal medicine physician practicing out of Edward Hospital. And I tell you what, today's show is going to be on fire. We're continuing our countdown to summer series. That's right, counting down to one of my favorite seasons of the year. Summertime, getting out, spending time with your family, your friends, your loved ones, making health a priority, investing in yourself, investing in your health, investing in your family, investing in your life. And without further ado, today we're going to continue this conversation. We had a great show last week talking about getting that beach body, that last minute prep. And this week we're going to continue this show going. We're going to continue to talk about health. Today we're talking about skin. And I tell you what, this Countdown to Summer series, it's really been about these last minute tips. And then I introduced this on social media a few weeks ago. We're talking about the last minute things that you can do right now that you can focus on for your health, to take your health to the next level, to maintain good health in the summertime and beyond. But remember, in order to have that good health plan, you have to continue to do the what, the why, and the how. What are you trying to do? Why are you trying to do it? And how are you going to get there? It's most important to have a team of healthcare professionals with you at all times to help direct you and guide you to your goals. And today I'm so excited we're going to be talking about last minute skin health prep. Those last minute tips, guys. Everything that you need to want to know about your skin, how to take care of your skin, how do we get ready for summertime, and how to invest in your health. I'm so excited. The panel today is on fire. You're going to meet them in a few moments. But each week on this show, what we try to do is break down some key themes. And skin is so important when you think about our health. Skin is the largest organ in the body, without a doubt. It's so fundamental to what we do. It is us. We're born with our skin. But do we do all the necessary steps to care for it throughout our lifetime? We're going to talk about that. We're also going to talk about some last minute things that you can do to make your skin looking best, to have your confidence on fire, kick it up in fuego, and make sure that you and your family have this great health trajectory for summertime and beyond. So again, my name is Dr. Mark Gomez. We're here broadcasting live at Intellectual Radio Studios. We're checking us out on Facebook.com as well too. You can check me out on my website, www.drmarkgomez.com. Each week, bringing you information, building trust, and delivering truth when it comes to your care. So what I want to do before we get into the meeting our guests, I want to hit you with a quick disclaimer. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and/or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. So I'm so excited. So we got this show. We're continuing this Countdown to Summer series, Skin. It is awesome. So we're going to talk about the tips that you can get, but also break down the things that are out there for you to help protect your skin and have your skin looking best. So I want to introduce my great panel today. They're exciting clinicians, experts at what they do. They've been in the field for a long time, and they're really here to help you, give you the necessary tools to take care of your skin now and for beyond. But remember, our guests will certainly tell you that it's important to establish care with a reputable practice, and we're going to talk about ways to make sure you're ensuring that your health is going to be taken care of and safeguarded without a doubt. So I want to introduce my guests today. I got my first guest who's in studio with me. Let me tell a little background story. She and I connected through actually her boss, Dr. John Bull, who was on the show last week, a plastic surgeon. And she's helping take care of the skin of my wife, makes her look radiant and everything. So I wanted to get her on the show and everything, but somebody who can speak volumes and passionately about the care of our skin. So I want to introduce my first guest. She's sitting here in the studio with me, Shannon Hobe, clinical esthetician, John Bull Center for Cosmetic Surgery and Laser Medi-Spa. Check her out, www.dupageplastics.com. Shannon, welcome to the show.
Thank you.
Please tell us a little bit about yourself. How did you get into this field? And really, what do you think about today's theme of skin and how it's important to take care of it?
So I've been in the industry for about 12 years. I have my cosmetology as well as aesthetics license. A lot of that, I've actually worked in dermatology for many years as both an esthetician and a medical assistant. So a lot of what I know actually comes from working in that environment so long. But definitely continuing education over the several years, focusing on medical aesthetics, laser and things like that. But yeah.
Yeah, and why do you think it's important to take care of our skin, especially as we're approaching summertime?
Well, like you said, it's our largest organ. It's the only skin that we get, so you want to take care of it, not just for aesthetics purposes, but for our overall health as well.
Excellent. Well, thank you for coming on the show. I look forward to talking to you more in detail. I want to welcome my next guest on the show. She's joining me on the phone. She and I connected a number of months ago at her open house, and we have a mutual friend, a mutual acquaintance that really connected our paths, and I really think that this is just a budding and blossoming relationship moving forward, and I can't wait to continue to do some more collaboration with her. So I want to introduce my next guest who's joining me on the phone on To Your Health with Dr. G, Dr. Mercy Odueyungbo. She is a board-certified dermatologist, founder and owner of Lilly Aesthetics. Check her out. She is the real deal. www.lilly, Lilly, derm, DERMMD.com. Dr. O, welcome to the show.
Thank you, Dr. G. Thank you so much for having me on the show. And hi, Shannon.
Hi.
How you doing?
Good. How are you?
Dr. O,
Good,
tell us
good.
about your background. Where did you do your medical school? Where did you do your residency training? And really, what are your thoughts on this theme? Why don't we start from there with you?
Okay. So I did my medical school in Indiana University School of Medicine in Indianapolis. From there, I trained in New York at Mount Sinai. So I did my derm residency there in New York City. And then I also did my Mohs surgical fellowship also in the same institution. And I'm very excited about this thing. I mean, I live, I breathe skin. I mean, that's like what I do. That's what I love. I always tell people, when you see someone, your skin is the first thing that they see. It tells a lot about you. So it's kind of like first impression. So keeping the skin healthy all year long is very important. So I'm very excited about this theme that you actually picked for us.
Excellent. Well, thank you, Dr. O, for coming on the show, and I can't wait to talk more in some details. So now that you've all met the panel today, again, the panel is fierce, no doubt about it. What we do in this show each week as you meet my guests, we talk about just the theme, and the theme of today is last minute skin health prep, things that we can do. And really how we always started out, when somebody comes in and sees us in the practice, we call that the chief complaint. And so that's why somebody's there visiting you, and for that particular reason. So the chief complaint / question of the hour is, what are the best ways to keep our skin healthy throughout summertime and beyond? So really what I do is I want to kind of get into some of these questions, and we're going to get you guys some tips. But again, at the end of the day, even though we're talking about different things that are out there, some of the new techniques and everything, you know, it's important that you establish a relationship with your healthcare team. If you don't have a dermatologist that you're working with, or a clinical esthetician, certainly talk to your physician, talk to your primary care physician, who can help direct you to those appropriate resources. And again, it takes a village, and I think that's an important thing that we can all of us here today talk about. You know, we have a healthcare team that takes care of us, but you also have to have a healthcare team that takes care of you, and that's important. So I'm going to ask the first question to Dr. O. Dr. O, I'm putting you on the hot spot, but it's all good. So Dr. O, in your perspective, you know, what is the single most important thing we should be doing on a daily basis to take care of our skin? What's your perspective on that?
The most important thing that I tell all my patients is sunscreen, sunscreen, sunscreen. So what a lot of people don't really understand is what you do in your teenage years, when you're in your 20s, actually doesn't catch up to you in a year or 2 years. It actually catches up to you decades later. So a lot of my patients say, you know, I've been wearing sunscreen, but when I was in my 20s and 30s, I didn't wear any sunscreen. So now we're having to treat a lot of skin cancers. Last week alone, I diagnosed 5 melanomas.
Wow.
So there's so much that sunscreen can do for you. It can protect you from aging, from wrinkles, from having sunspots, from burning. So the number one thing that I tell all my patients is find a good sunscreen that you like and use it religiously all year long.
Excellent. And melanoma is the third most common skin cancer, but it's the most likely one that can metastasize and certainly result in death. So when Dr. O is saying that your sunscreen is paramount, you've got to do it. You know, it's interesting because you always think about, like, you know, maybe it's too macho, I'm a guy, I don't want to put sunscreen on. But Dr. O, can you clarify, like skin cancer does not discriminate men versus women, old versus young?
No, it does not discriminate at all. And I actually find a lot more skin cancers in men. Because one thing I found out with my male patients, they don't like a regimen. They don't like a skincare plan. They don't want to put creams, as they call it, goo on their face. So most of the skin cancers are usually in men because they don't want to put anything on. If you tell most women that if you put sunscreen, it's going to prevent wrinkles, usually we'll do it. But most men do not. So men, women, I've even done skin cancer surgeries in patients as young as 18 who started tanning at a very early age. So young, middle, old, it does not discriminate at all. All depends on how much sun exposure you've had in your lifetime.
Well, thank you, Dr. O. So let me ask this question to Shannon. Shannon, Dr. O is talking about, sunscreen, and one of the biggest things that is important to her as a dermatologist for her patients.
Right.
Do you have a kind of an important thing, like the single most important thing for your end as a clinical esthetician? What's important to you? Would you echo that, or would you add anything else to that?
It would be sunscreen as well, for sure. Like I said, just not from the anti-aging perspective, but for the overall health of our skin.
Do you notice that from a clinical esthetician perspective, or in your patient loads? We talked a little bit about some of the stubbornness of guys, and that Dr. O's seeing a lot of skin cancer in men. Do you see a lot more men being hesitant to try to do some services with you, or do you see more women doing services?
Of course, obviously I see more women, but I do see a good amount of men being in a medical office. I think that helps what setting I'm in. But yes, there's definitely a little pushback with products, especially sunscreen with men, because normally the feeling of it they don't like. But.
So summertime, of course, you can't talk about summertime sun exposure and basically protecting your skin. Dr. O, is there an amount? Let's stay on this topic. Is there an amount of sunscreen that somebody should be using as we're getting ready for summertime? What's your thoughts on like the amount to use, the SPF rating, how often to apply? What's your thoughts on those kind of questions?
So I don't know if I'm kind of jumping around, but so I always describe to patients. Patients are always saying, what's the difference between SPF 15, SPF 30, and SPF 50, and what kind of sunscreen should I use? And I would tell them, really the SPF just kind of lets you know the amount of UVB protection that it's giving you. So I always try to break it down. So when you buy a sunscreen tube or bottle, you always see UVB and UVA. So UVA really protects you against aging and wrinkles. UVB protects you against sunburn, and the sunburn is what can lead to skin cancers in the future. So I would tell patients SPF 15 really only filters about 90 to 93% of UVB rays. SPF 30 really about 97, SPF 50 about 98. So it's not really much variation between all of them, but I always tell all my patients minimum SPF 30, but I try to tell everyone to get at least SPF 50. And what I tell them is, it's not the kind of sunscreen that you get, it's really how often you reapply and if you're going to use it. So all year long, I would tell patients, kind of imagine a shot glass full. That's about the amount of sunscreen that you should be applying. And also, you have to apply it at least 30 minutes before you actually go outdoors for it to be very effective.
Excellent. Well, thank you for breaking that down. And I think that's a great thing. Summertime, we're going to be at barbecues, cookouts, poolside, sporting events, and you have so much exposure out there. It's warm. Hey, we want to wear short sleeve shirts. We want to maybe not wear a baseball cap. You want to be out. We just emerge from winter again and all that kind of stuff. So a lot of people just say, all right, I can now expose my skin to the elements, but doing so is certainly putting you at risk if you're not protecting yourself. So let me ask this question to Shannon. Dr. O was mentioning a few moments ago about some of the cumulative effects. She'll see things that are happening, and you'll see them too as a clinical esthetician, but you'll see the cumulative effect of sun damage on your skin. From a clinical esthetician standpoint, what are some of the treatments that are out there? If somebody's got signs of sun damage, what can that person do besides put on sunblock? But what are some treatments that they can do to help reverse some of those effects, if any?
You can't really, unfortunately, the damage is done.
It's done.
But there are things that I can do to treat the appearance of sun damage. Lots of different laser treatments, chemical peels, even just exfoliating and products at home can definitely help maintain, if not improve, sun damage.
Excellent. So why don't we talk a little bit about some of these kind of things, because you mentioned chemical peels and some of that stuff. Can you break that down a little bit for our audience? Chemical peels, we talk about various skincare treatments. What are some of the differences? Let's talk about chemical peels. What is that for a person who's out there who's listening to us?
So a chemical peel is a solution that we're applying to the skin to exfoliate. At the same time, depending what type of peel, they have many different strengths, ingredients, depending what we're wanting to treat. So if it is sun damage, Obviously, we want to use a peel with something with hydroquinone or some type of lightening ingredient to hopefully lighten any of that pigment and kind of give them more of a glow.
And the peel, and again, I'm wearing my internal medicine hat,
Yeah.
so as I was trying to prep for the show, I'm like, oh, I got to read some dermatology literature, I got to read some esthetician literature, all that stuff. I'm like, hey, I don't see this kind of stuff on the daily basis. I usually just refer out. I mean, although I do tell people, apply sunscreen all the time, all year round, without a doubt. But from my understanding is that you do the peel, and that superficial layer just kind of slowly comes off.
Yes.
And is it an immediate coming off, or is it usually within a few days or something?
Normally, yes, you'll definitely have peeling, so there is definitely a little bit of downtime. Again, depending what strength, there's many different types of peels. So we can go from mild to very aggressive. But normally the peeling will start day 2, day 3. So that treatment definitely comes into play with the scheduling factor depending what you have going on. You want to give at least, up to a week prior to, an important event if you don't want to go somewhere with dry skin and peeling, flaking.
I think of like a lizard, and your skin's kind of coming off a little bit, but you're exposing that new layer, that fresh new skin. Those
Right.
cells have to turn over and get rid of the damaged skin. New cells come in underneath, and now hopefully a more vibrant, healthier kind of approach. Let me ask this question, Dr. O. Dr. O, when you're advising patients on chemical peels or other treatments, which we'll get into more of the treatments in a little bit. Let's stick with the peels right now. Are there any particular clinical situations you may advise that peel for? You think about people coming in with, do you do it for wrinkles? Do you do it for age spots? Do you do it for acne? What do you do it for?
So one of the most common reasons why I'm sure Shannon also sees this that we use chemical peels for is usually for acne and post-acne scarring. It works really well to kind of help to shrink up those sebaceous glands, kind of helps with exfoliation, kind of helps with hyperpigmentation, which in darker skin tone, that's one of the side effects of having acne. Another time when I always refer for chemical peels to my patients is there's a condition called actinic keratosis. When the patient has so much sun damage, they actually have scaling, redness, and crusting. And certain types of chemical peels actually work really well, like Shannon said, to kind of help exfoliate, and like you said, to kind of reveal kind of like that new baby skin underneath.
Excellent. Well, thank you for the clarification on that one. And Shannon, from your perspective, you have your role as a clinical esthetician, so you're seeing stuff that gets referred to your practice and everything. What kind of management plan? Let me take it even a step back. How do you kind of customize somebody's skincare plan when you see them for the first time? How do you kind of break that conversation down and then kind of recommend what would be ideal for that particular person? How do you kind of take that into consideration?
Well, there's a lot of different factors because everyone's skin is so different. Besides budget, but depending what their main concern is, a lot of times I'll see patients that will tell me something that they see that not necessarily that I see. So you definitely want to, communication's huge, to see what their concerns are and what their goals, what they're trying to achieve with their skin. But there's a lot of different aspects for sure.
Excellent. And then Dr. O, how do you approach your patients? If you're going to recommend certain kind of services to them, how do you kind of just have that initial conversation with them?
So one thing I always do, I always give them a mirror. I always ask them, what do you like about your face? And then they tell me what they ask. And I always ask them for a picture of when they were younger or when they were actually happy with their skin, and kind of go from there. So, and also based on the skin tone, not all chemical peels are safe for all skin types. There's certain chemical peels that you can't really use on darker skin, just because of risk of scarring and hyperpigmentation. And also, when you're thinking about a regimen is, like Shannon, how much downtime do they have? Some chemical peels you're going to peel in a few days, some you don't really see the peeling for 7 days. And there's certain chemical peels that I don't recommend in the summertime just because of the risk of peeling and also sunburn. A lot of my patients travel a lot, so they don't really want a lot of downtime. So for aggressive chemical peels, like the deeper depth ones, I usually save it for the winter time or in the fall when patients are not really traveling or they're not really out socializing a lot.
And so let me come back at you with another question, Dr. O. So say somebody's getting a chemical peel, do they immediately need to put sunblock on to help protect their skin from UV rays?
Oh, of course. Before they even walk out of the office or out of the Medi-Spa, they are getting sunscreen. We give them sunscreen samples. and we actually send them home with sunscreen. They never leave the office without sunscreen on.
Excellent. And again, I think about that because now you're just exposing this new skin that's going to be coming in very shortly, within a handful of days.
Mm-hmm.
So that's great that you guys have a preventative mindset, but also kind of reinforces the point on, hey, you've gotten this treatment done, and now we want to make sure your skin is protected from here on out. Out of curiosity, Shannon, from your perspective, how many treatments does somebody need? Say like you have there may be some parents out here that are listening, their children, their teenage may have acne or acne scars, or even some adults as well too. But how many treatments does it usually take? Does it just kind of depend on the person? How do you kind of approach that?
Well, of course, it depends on the patient. But normally 4 to 6 a series, we say, over the next couple of months. It's not an overnight process, so yeah, the realistic expectations are necessary, but that's part of multiple services and, again, expectations and educating.
Excellent. So, Dr. O, I want to ask you this question. I want you to break it down for us. Because I think the general public has a good idea what dermatologists do, but I want you to break it down for us. Can you break down a little bit between like medical dermatology, surgical dermatology? We were talking a little bit ago about you were just doing a procedure on a client patient earlier, but you've diagnosed some cases. So how about the difference between medical dermatology, surgical dermatology, and like cosmetic dermatology? What are the differences?
Oh, there's a big difference. So medical dermatology is usually when a patient comes in for a certain medical condition such as acne, psoriasis, eczema, also full body skin exams, lots of rashes, just anything that's concerning to the skin. So that's kind of more medical. So I'm a Mohs surgeon, meaning I treat a lot of skin cancers and I do a lot of facial reconstruction. So for surgical derm, it kind of gets broken down into like the aggressive skin cancers and just kind of taking off benign things. So when I'm doing surgical derm, that can range from doing melanomas, it's a type of skin cancer, probably the most deadliest one, which is what all patients are scared of. Then there's basal cell carcinoma, which is another type of skin cancer. It's actually the most common type of skin cancer. And then there's squamous cell carcinoma. Those are kind of the big three that usually people can get and can actually spread. They can all spread. And then we go into like the benign moles, removing skin tags, removing moles that are a little atypical. And then cosmetic dermatology is when a patient says, you know what, I don't feel my best, I don't look my best. What can you actually do for me to get me looking the way that I actually feel or the way that I want to look? And that actually goes into the whole, like, Botox, fillers, lasers, chemical peels, and it's a whole different realm.
Excellent. Well, thank you for the distinction on that one, and I'm glad that we're able to talk about that. I know today we're focusing a little bit more on some of the cosmetic approaches, but it's important for people to know out there that yes, your dermatologist has a whole tool belt, and certainly a dermatologist like Dr. O has a literally utility belt of resources to meet all of your dermatologic needs. And again, I use the word all in capital letters, right, Dr. O? A-L-L.
Yes.
So there you go. Excellent. So I want to go back a little bit to some of these things. Again, we're talking about this theme of summertime. We're talking about, how do we get our skin better? How do we get our skin looking good? How do we continue to keep our confidence up? I want to ask this question. I'll ask this question to Shannon first. Shannon, what's your personal approach? Because I think people out there want to know, like, what are some of the experts doing? So what's your kind of personal approach to your own skincare? What are you doing?
Well.
And I'm going to ask Dr. O that question too.
Your skincare regimen at home is really important. It definitely maintains more of what you do in the treatment room. Exfoliating is super important. I normally recommend 2 to 3 times a week. I do that for myself, somebody with a drier skin type. It's super important. But staying out of the sun and sunscreen is huge. I did my damage many, many years ago, so that's super important for me.
Excellent, excellent. And Dr. O, do you have kind of a skin regimen that you follow yourself?
Oh my goodness, where do we start?
I've seen some of your social media, by the way. I know you're getting it.
I was joke. I said, is today going to be a 7-step day? Is today going to be a 10-step morning, depending on how much time I have. So one of the biggest things for me is kind of like how Shannon said, double cleansing, kind of getting all the oils, all the gunk out of your skin at the end of the day. Also, exfoliation is really big. I agree with her, but I usually do it a little bit more because I tend to be drier and I use a lot of product, so I exfoliate a lot. And my biggest thing, a lot of patients always ask me, I do a lot of vitamin C serum in the morning and retinoids at night, so a Retin-A. and sunscreen, sunscreen, sunscreen. I would say no matter what skin type you are, you know, a lot of darker skin patients think that they can't get skin cancers or they can't get a sunburn but, you know, I want to protect myself from aging. I want to protect myself from skin cancer. So when patients say that, I would tell them, you know, Bob Marley died of melanoma,
Yes,
you know,
sure
so it doesn't discriminate like you said earlier. So sunscreen, 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 30 minutes before I leave out the house. But definitely having a regimen, like Shannon said, it's not a one step, it's not a one night, you know, magic. It's definitely like going to the gym. The more time you put in, the more results you're going to see.
Excellent. And my kind of own thing is what I do. I kind of will piggyback on what Shannon said. You know, exfoliating usually twice a week. I have my microdermabrasion visits about every 6 weeks, and sunscreen like it's gone bananas. I mean, every single day you got to do it like gangbusters, and I think that's a great thing. So let's talk a little bit about some of these kind of other techniques that are out there. So Shannon, you know, I just mentioned the word microdermabrasion. Can you talk about a little bit about that procedure? That's some of a common procedure that a lot of people get from their clinical estheticians.
Yes, we normally recommend every 4 to 6 weeks because it's considered an exfoliating treatment. It's actually a machine where I'm at. We actually have a diamond tip, so it's polishing the surface of the skin as well as it has a suction aspect to remove any dead skin cells, blackheads, anything like
The
that.
suction feels great, by the way, I must say. When I have mine done, I'm like, and that feels good. Like a little miniature vacuum on you. But what is it commonly used for as well to you? Or just, I interrupted you, I apologize about that.
No.
But you mentioned like blackheads, acne, things like that. What else?
So it can actually help with, besides acne, for sun damage to improve the texture. A lot of times I actually combine them with chemical peels. So we'll do the microderm first and then we'll apply a peel right after, depending on, again, what the patient's looking for and what they have coming up. But
Excellent. And then that person would still, same thing with the chemicals peel, they would expect to have to go through, you know, a series of treatments to really get that effect.
If you're really trying to see more like a correction, definitely a series is realistic. Anything that we do, you can't just do once and expect to see a whole lot of correction, but you'll see a huge improvement with one, of course.
Excellent. And I would say, even though, you know, and this is what I tell some of my patients, and again, I'm wearing my internal medicine hat, but also just as a physician in general, in addition to sunscreen, I say if you're going to have a treatment regimen with your clinical esthetician or with your board-certified dermatologist or plastic surgeon, you know, it's important to maintain. You're like, I don't want you to just stop at like, hey, it's been 6 months and say deuces, say see you later. No, I want any kind of health plan, like my diabetics. I want you to continue to focus on this, focus on that, and continue to have the follow-up. So do you both, let me ask you, Dr. O, do you usually recommend your patients that are coming in for cosmetic type treatments, do you recommend that they have more of a continued follow-up, or do you just say, you know what, you've graduated from us, your skin looks flawless, I'll see you in 5 years or something like that?
Oh, no one ever graduates. Because the thing we have to remember is the skin is constantly turning over about every 21 to 28 days. So it's like you could look great from all the treatments, but if you don't keep it up, you're back to where you started again. So everyone definitely always has a follow-up. As you progress along, like your regimen, you don't have to come every month or every 2 months, but I definitely have patients come back at least every 4 to 6 months once they're kind of maintained on a regimen. And usually send them home also with a regimen that they can maintain on their own to kind of help maintain their skin. And once they're at a point where they're doing really good and I don't think they really need me, I kind of extend out their office visits.
Gotcha, thank you. And Shannon, from your perspective, are you still recommending that the continued follow-up for your patients?
It depends on the treatment. For facials, microderms, chemical peels, we actually do recommend every 4 to 6 weeks. But again, more like lasers and more, you know, stronger aggressive treatments, not as frequently. You know, I can slow down the aging process. I can't stop it. So, you know, patients do have to remember that we are aging, unfortunately, every year. So.
And I always tell people this again, wearing my internist hat, but trying to read and keep myself having this great conversation with you both. You know, I tell people this: genetics and sun exposure are the most important things that I think, as an internist, play a role in the aging process. And so your plan has to be tailored to you. But I always tell people, make that first step. Just like you're going to come and see me for a physical. And by the way, I've said that many times on Your Health with Dr. G. Get a physical once a year. See your primary care physician for that physical. They're going to protect you when the you know what hits the fan and your health may go down, your primary care physician is there for you all the time. And so when it comes to like your skincare, which is just another thing. If I had a patient that said, I need you to go see a cardiologist because, you know, your heart issues, or I need you to go see a lung doctor because of your breathing issues, you know, I'm going to say the same thing. I need you to see a dermatologist all the time because our skin is it's literally us, as you both have said. The skin is the first thing you see. It's the first line of defense for your body, and so it's like the gateway. So protect your skin at all causes, and I definitely want to say that, and I'll preach it from the mountaintops. So let me ask this question to Dr. O. Some of the other things that people are doing, last minute skin health tips. You know, they're doing things like injectables. We talked a little bit about obviously microderms. We said a little bit about chemical peels. What's the concept behind injectables for patients and clients to help them get their last minute skin health prep going on to get that look that they're going for?
So when we talk about injectables, I'm not sure if you're also talking about like Botox too. Do you consider
Yes.
that? I mean, so most people think about fillers as injectables, but so basically a lot of people talk about Botox and fillers do different things. And I think that I'm just going to use the word toxin because there's so many different toxins out there.
Okay.
So what they do, they kind of prevent muscle movement. So over time, with dynamic muscle movement in the face, you tend to make lines. And at some point, the lines become more static, meaning they're always there, versus dynamic only when you move. So that's what the toxins are good for. So if a patient asks, what's the one thing that I can do that will really make a big difference? Usually some kind of toxins to kind of soften the lines, get rid of the lines, and also get them on a regimen where we actually prevent the lines from forming in the future. And then when it comes to fillers, as we get older, after actually about your mid-20s, you start to lose volume and you actually start to lose collagen. So most of my patients range from like in their 20s. I've actually had patients up to 80 years old before they came in for injectables. So basically what those do, they pretty much just replace lost volume and kind of give you a youthful look again. So those are the two main things that I think makes a big difference in a patient, especially when they want rejuvenation and like a last minute kind of like a umph to their skin and to their outward appearance.
Excellent. I would say like sometimes people will notice it, and you may notice it, those of you that are listening, you know, you might take that selfie of you, or you're in another picture, somebody sends a picture, you're like, hey, I didn't authorize you to send this picture of me. I didn't really take a picture, and then you kind of say, wow, I don't like how I look, and we talk about, you know, when I talk about health, I want people to feel confident in their health, not just their physical health, their mental, their emotional, but even their appearance as well too, to have that there. And so sometimes you can get those things, those still pictures, and you're like, oh my gosh, that's a frown line. There's some crow's feet going on there. There's you know, all this kind of stuff. So I think it's so important what you're talking about, Dr. O, on different options that are out there. But people have to make that step to come in and see you or to come in and see Shannon. Otherwise, you can't help them if they don't come in. So what's your thoughts, Shannon, on some of the other kind of, you know, injectables from your end? And Dr. O mentioned like Botox and a little bit about some dermal fillers. What do you guys do from a clinical esthetician standpoint? What's your perspective on those kind of things?
I'm all for them. Most of my patients do get injectables. So a lot of times, you know, they can actually, what I do in the treatment room can actually help maybe not needing as many injectables because I can treat, you know, the surface, but I can't affect their muscle movement, where that's where Botox comes into play. So they definitely can, I say, complement each other for sure. But
excellent. So you guys are listening here. We're here at Intellectual Radio Studios. We're broadcasting live on Facebook. We're talking about skin and last minute skin health prep, and really focusing on things that you can do, kind of last minute things to get yourself ready, but to keep you going. I want to mention something to Dr. O, because I just read about this, and I think it's a great reason we'll talk about it. There's something called Kybella. Hopefully I'm pronouncing that right, but it's something that's like, I guess it's like taking the dermatology and plastic surgery worlds by storm. What do you know? Can you explain to our audience a little bit about this? Do you know much about it or using it in your practice?
Yes, I do use a lot of Kybella. So I always describe Kybella as kind of the easiest before we get too medical. So basically imagine like a soap, you know, basically is the first FDA approved treatment that can dissolve fat. Usually when it first came out, the indication was for under the chin. But now, as you know, when one thing comes out, we try to find other places to put it, you know. I want to do that, you know. So basically what Kybella does, imagine kind of soap kind of breaking down fat, kind of breaking down grease. It kind of soaks up the fat that's under your chin, and it kind of dissolves it, and your body kind of just gets rid of it. The great thing about Kybella is usually the fat doesn't come back. You know, once the fat's gone, it's gone, as long as the patient maintains a healthy lifestyle. Like everything else, there are side effects, but it does work really great. So when it first came out, we were putting it under the chin. Now we can put it in if you have a little, you know, like a belly pull, just a tiny amount, a little back fat roll, a little brow roll, a little armpit roll, like under the arms. So now we can put it anywhere that you have a small amount of fat pocket, but most patients usually just come in for a little bit of fullness under their chin, and I think it works really well.
Excellent. Is that usually one treatment and that's
No,
it, or is it multiple treatments?
Patients, about 2 to 3 treatments spread out. Usually after about 2 to 3, that usually does the trick.
Excellent. You know, one of the things I love about even though I chose to go into internal medicine, one of the things I love about dermatology and skin is that there's just we're really pushing the envelope, and maybe this is a combination of just technology catching up with us and more creativity and human ingenuity. But I think the field of dermatology is fascinating. I always say, like, when I had my medical boards, I did not like those dermatology related questions. I can go ahead and say that. But I thought the field was fascinating, and hearing some of these new things that are out there. I mean, everybody's heard of like Botox, but these other things that are out there that we just don't have these kind of conversations. I'm glad that we're having this conversation in this forum, because there may be people out there might say, hey, you know what, she's speaking my language, Dr. O is speaking my language, or Shannon's speaking my language. Now I want to maybe do something about this. So I think it's great to have this kind of engagement, this conversation, to then promote more engagement down the road. So let me ask this question. A lot of times when we talk about skin, we've been talking a lot about face, but skin is everywhere. It's all over our body. There's no doubt about that. So there's other things that we do about skin. You know, people that want to get rid of some cellulite, some extra fat tissue, people that have varicose veins. There's so many treatments out there that are there for you that you just have to have that conversation with. So I want to ask Dr. O, I'm going to come right back at you. What are some of the treatments that they're doing now for body contouring? That's a theme that I always get a lot in my practice as an internist, and I usually have to refer out to that, of course. But what's this body contouring wave that's going on right now?
So there's so many treatments, and basically it's the right patient selection and finding the right treatment for them. Everyone wants to look great, everyone wants to look slim, everyone wants to look like their best self. So cool sculpting is like the big one. There's one on every block. You know, everyone, I don't know if you've heard Dr. G about cool sculpting. I'm sure Shannon has.
Yeah. We did. Dr. Shannon's boss, Dr. Bull, mentioned it briefly last week, so it's all good. But
Okay.
Please explain again.
So basically, cool sculpting is FDA cleared for basically treatment of fat in the chin, thigh, abdomen, bra fat. Basically what it does, it kind of imagines freezing the fat cells, and your body gets rid of them. So basically, after you do this, usually the fat doesn't come back, but you have to pick the right patient, because there's only about maybe 24 to 28% improvement. So if you, like I said before, kind of with Kybella, if you pick the right patient with a small amount of fat, they've been going to the gym, but they can't really lose this last little bit, I think cool sculpting is a great procedure for them. But there's so many on the market, you know. There's SculpSure, there's TrueSculpt. I mean, there's so many different ones on the market. The other thing that most patients come to me about, no one likes cellulite. Everyone hates their cellulite, and it's so hard to treat. And there's so many things on the market. For example, there's cellulase, which is a minimally invasive treatment. Basically, we put a little laser fiber into the skin, and that breaks up a lot of the bands under the skin. And all of them do the same thing. There's Selfina, which is FDA approved. They say it's supposed to work for over 3 years. That's also a needle going into the skin, breaking up those tough bands. There's vacuums. There's weight loss. That's always a great option and probably cheaper. People exercising and kind of increasing their muscle tone. There's lots of lasers that you can do for it. There's Bella shape. I mean, it's so many treatments out there. So I usually just say, you know, see your doctor, see your dermatologist or plastic surgeon, and they'll pick the right treatment for you.
Thank you, Dr. O. Shannon, what's your perspective? You know, you're seeing clients coming in that are doing body contouring in your practice. How's the general approach to that? Does it involve multiple treatments and follow-up?
We do a lot of cool sculpting at our practice, and definitely the right patient needs to be a candidate, so we definitely are very honest with our assessments. It's nice that I work in an office where Dr. Bull is available as well for surgical approaches. But we definitely have some non-invasive options for cellulite. As you said, it's very stubborn though to treat. It is hard.
Yeah, I think. Please go ahead.
No, but there are options available that you can attempt. But again, selecting the right candidate and going over expectations for them and educating is so important. So.
Well, I think again, as we all want that, we all want our health to be there for the long term. I always talk to my patients. I talk about themes of longevity, vitality, aesthetics, quality of life, and hopefully leaving a legacy at the end of your days. And so trying to do this together and having the right team behind you is very important. But it's also important to know that there are so many options out there. When we talk about cellulite, I was thinking like, that stubborn, unwanted, diet-resistant, exercise-resistant fat that we all want to get rid of. And I want to refresh people to my show last week. We talked about some other kind of collaborative efforts to try to help that go away. So what I want to do right now, I want to ask a few more questions, and we're going to get into our myths versus facts. So I want to make this important today because I have this show for a reason. I want people to have the right information. So I want to, Dr. O, can you talk about the difference between a dermatology-based medical spa or plastic surgeon-led medical spa versus the commercial spas that are out there? What's the difference?
I think the most important difference is the medical aspect of it. So, for example, we'll get a patient that comes in for like laser hair removal, and as you know, as an internist, you kind of have to think, why is this patient having more excess hair than normal? Do they have any internal medical conditions that's causing this? Because you can do all the laser hair removal in the world, but if you don't treat the internal factors such as like PCOS, polycystic ovarian cystic syndrome, or if a patient has thyroid disorder. So I think basically being able to direct a patient from just a cosmetic, reason for coming in to medical and actually give them the results that they actually need. Also, too, like I've had a lot of patients coming in for laser treatments for a dark spot, and that dark spot actually ended up being melanoma. So when you have a plastic surgeon or a dermatologist, they can actually identify, and if you train your staff the right way, they can also see that this is just not a regular dark spot or sun-damaged skin. This patient actually needs to go and see the doctor to get a biopsy to make sure this is not a skin cancer. I think that's really the main difference, too.
Well, thank you, Dr. Owen. You're really talking about how, you're investing in your health, and we want your resources to be people that are credentialed in what they do, board certified, and have gone through the necessary training to make your health stay awesome. And to keep your health a priority, because you're investing in your health every day. You wake up every morning, you're doing things that you got to do for you and your family and for yourself. But you've got to make sure you make that done in the right way by the right people. And Dr. O, you just gave a great example of something that happens way too often, more so than it should, and we have to make sure we set the record straight. Shannon, let me ask you this question. It's kind of a playoff of having a medical dermatologist or plastic surgeon-led med spa versus a commercial spa. What's the difference between medical grade skincare products and over-the-counter skincare products?
Normally medical grade, there's definitely never fragrance added, but the products are more potent, so they're stronger, the strength of the ingredients. Over the counter is normally diluted, and you can't get results-driven results as much as using medical grade products.
Is it true that the over-the-counter products typically only really get to that kind of the superficial layer of the skin and not really penetrate into the deeper layers of the skin, the dermis, and then the basal layers? Is that the correct understanding?
Yes.
So let me ask this question. Let me ask one more question to you. So do you see some patients that have failed over-the-counter medical skincare treatments? Think like a adolescent with acne or people with other kind of scarring or blemishes, hyperpigmentation. They try to do some of the over-the-counter stuff and they fail, and then they might even maybe make things worse.
Yes, it definitely happens. They're trying too many products, and they're not educated, and that's kind of our job, though, to examine their skin, to recommend what's best for them, and it's an investment. So a lot of times, even over the counter, you can spend a lot in products, and if they're not going to help your skin, it kind of defeats the purpose. So.
Yeah. Well, thank you. And I say, as an internist, for optimal skincare, after you get your treatments done by Dr. O's team or Shannon herself, it's important to have medical grade products that help complement and so you can get deeper penetration into the skin so you can look your best. So what I want to do, I want to get into the session that I do every week on the show called Myths versus Facts. And I think that's an important thing, as we talked about this whole show, and even in the beginning, we're all about making sure we set the record straight regarding our health. And that's why we do this show every week. And so again, we've been breaking down skin, last minute skin health tips. You heard some experts, you heard our experts talk about some of their own regimens, some of the things that are going around with patients that they see. You even heard me comment as an internist, but what I see as well too. So I want to make sure this record's set straight. So myths versus facts, how it works. I say a statement, and then my panelists will say myth or fact. It'll be kind of rapid fire, maybe a few sentences on why it's a myth or why it's a fact, and we'll go from there. All right, so first question to you. I shouldn't say question. My bad, Dr. O. It's a statement. It's not a question. So first statement to you, myth or fact. So here we go. Myth or facts, this is the skin health prep. All right, first statement. Customized skin treatments are available for all skin types. Myth or fact?
I think that's a fact. I think if you get the right skin treatment for your skin type and for whatever condition we're trying to treat, I think it can be amazing. But there's not one size fits all. You know, what works for me might not work for you. So I think definitely talking to an expert and coming up with a regimen for you goes a long way.
Thank you. Here we go, Shannon. Myth or fact? Here's a statement. If I put sunscreen on in the morning, I'm covered all day long.
Myth.
What? That's a myth?
Yes.
Please explain.
You definitely, especially when you're out and exposed to the sun, you want to reapply every 2-3 hours, especially, and if there's water involved, you want to reapply after you get out of the water or sweating.
All right. Thank you. Here we go, Dr. O. Here's a statement. Myth or fact? This one's a little bit of a long one, but here we go. Maintaining a healthy diet, drinking water, and minimizing stress are some ways to best support your skin.
That is a fact. That is the golden ticket to living a great life, Dr. G.
Yes, I should have answered that one. I should have participated. I should have participated in Myths versus Facts, but I'm going to keep picking on the both of y'all for this one. All right, here we go. Thank you, Dr. O. Here's the next statement. Shannon, here we go. I like this one. We'll continue with the sunscreen theme. All right. Here's the statement. I don't need sunscreen on cloudy days.
Myth.
Please explain.
The UV rays can still penetrate through the clouds, so you definitely still can get a sunburn and you're still damaging your skin.
All right. Here we go. Dr. O, here's a statement. Myth or fact? Skin cancer does not run in my family, so I do not have to worry too much about sun protection.
Unfortunately, your genetics does not protect you against skin cancer. Actually, your sun exposure and also using sunscreen is what's going to protect you from skin cancer. So that's the myth.
All right, thank you very much. All right, here we go. Shannon, this one's for you. Dermatologists or plastic surgeon-led medical skin facilities are equivalent to commercial spa skincare facilities.
Myth.
Please explain. I know we just talked about it. Please explain again.
That medical grade skincare is definitely different versus the commercial or over-the-counter products. For sure, there's a difference.
Thank you, and I'll just piggyback again. Invest in your health, as I said. Invest in your skin. You go to the right people that have the right credentials, that are trained to diagnose and take care of your skin as much as possible. Here we go, Dr. O. Here's a statement. Oh, I like this one. Here we go. Summertime skincare regimens should differ from year-round skincare regimens.
I agree with that. I agree. I would say that's a fact.
Okay.
So, for example, I would say in the summertime, usually most patients are oily, so I always say you can change up and kind of go into oil-free. In the wintertime, usually you need thicker products to kind of layer on. But the one thing that does not change at all is the amount of sunscreen that you put on, at least a minimum of SPF 30, but I tell all my patients SPF 50. But the lowest I let them go is 30.
All right, thank you. Here we go, Shannon. We'll do a couple more of these. Here's a statement. Sunburn, we didn't really talk about sunburn too much, but here's a statement anyways, we'll give it to you. Sunburn continues to burn your skin even after getting out of the sun.
Fact.
Please explain.
You can get a sunburn, I believe, in as little as 30 minutes, but it actually normally takes a couple hours to actually see that entire sunburn.
Excellent. Dr. O, you want to comment on that one as well, too, about sunburns?
So usually when you're out in the sun, kind of like how Shannon said, you know, it happens very quickly. I always tell patients you probably only have a minimum of about 15 to the maximum of 15 to about 30 minutes. I always tell patients to get their vitamin D. But after that, you're at increased risk of the sunburn. And usually what happens days after is the inflammatory reaction that happens. So when you get the blister, the the skin peeling. All of those are kind of your body trying to clean up all that mess and a little bit of inflammation. But you can continue to burn your skin even after getting out of the sun because the damage is kind of already done, and now your body now has to like heal itself again.
All right, thank you. And we'll do this last one here for you, Dr. O. We're going to continue on the theme because it's important. And as you said at the beginning, all of us said the single most important thing you can do right now is to protect your skin is by using sunscreen. So here's a last statement we'll do today. Here's the statement. If I did not wear sunscreen as a kid, starting now will not help protect against skin cancer.
So that's a myth. A lot of people did not wear sunscreen when they were a kid because also there wasn't a big push. People didn't really understand how important sunscreen was. So a lot of my patients now with skin cancer did not wear sunscreen when they were kids. What I tell people, what you do now will protect you decades from now, so 10, 20 years. And like I said before, the damage that you have now happened 10, 20 years ago. So just because you didn't wear sunscreen when you were a kid, you still have to start now because it will protect you many decades to come.
All right, thank you. So, hey, we got about 5 minutes left. This has been a great show. I talked at the beginning, the chief complaint on why we're talking about these last-minute skin health tips for everything. After somebody has a chief complaint, when they're done leaving our office, we call it the assessment and plan. So we're going to break it on down and wrap it on up. But so what I want to do, I'm going to ask Dr. O have you start first as you're on the phone. Give us a couple take-home points. If you had to say, if I'd say, Dr. O, just give me a couple, 2, 3 important take-home points for people who are listening to us today to really know about their skin. What should they get from today's message about skin?
So skin cancer is definitely rising as one of the most important causes of cancer. And the most important way to prevent yourself from getting a skin cancer, like we said over and over, is to get a good sunscreen that you like. People are like, which sunscreen should I use? I say, I don't care. Anything that you put on with at least SPF 50. And I always tell patients, what can I do to stay young? There are 3 things. SPF, use some kind of antioxidant, vitamin C, vitamin E, a combination of those 2 in the morning, later your sunscreen on top, and any kind of retinol or retin A at nighttime. I always say those are the 3 main things to prevent aging, to prevent yourself from getting a skin cancer, and to get you looking your best.
Well, thank you, Dr. O, and it's been a pleasure having you on the show. Please hold the line. Shannon, give us a couple take-home points for people to be successful with their skin out there.
Again, sunscreen. But trusting your provider, getting your skin checks. Again, the health of our skin is super important besides the appearance. But exfoliating, like she said, retinol and sunscreen. And again, just maintaining healthy skin.
Well, I think that's a great thing. And kind of my final points are this. Our skin, again, as I said, we are born with it, but are we doing the necessary things to help protect it? The reality is that our skin just serves so many functions on just protecting our health. And we want to make sure that you set the groundwork now to set you up for beyond, for the long game. We're talking about the things that you can do now that'll have cumulative and hopefully great returns on that investment when you get healthy again and in the future. The reality is that we all want to have clear, healthy, youthful, rejuvenated type skin, but we have to work for that. And I think the best way forward is to continue to work with your primary care physician, of course, and then continue to use the resources that he or she has, including board-certified dermatologists and clinical estheticians that will help you keep your skin game on fire, without a doubt. So I want to thank my guests today. This has just been a great show. So I want to thank Shannon Hobe from the John Bull Center. Shannon, thank you very much for coming on to the show today. It's been great. Let me read her credentials again so I don't mess it up. So Shannon, of course, clinical esthetician, of course, at the John Bull Center for Cosmetic Surgery and Laser Medi-Spa. Check out Shannon at www.dupageplastics.com. And I want to thank Dr. Mercy Odueyungbo, board-certified dermatologist, founder and owner of Lilly Aesthetics. Check her out, www.lilly.com. So I want to thank everybody for coming out today. Hey, listen, everybody, this has been another great show. You've been listening and watching live on Facebook and intelshowradio.com. This episode is written by Mark D. Gomez and Tiffany E.R. Gomez. Producer is Tiffany E.R. Gomez. Music is by the wonderful Mr. Havis, my brother-in-law. Give him a shout out. Copyright 2019 by MDG Wellness LLC. All rights reserved. Stay tuned for my next episode. We're going to conclude the Countdown to Summer series next week. It's called Countdown to Summer Part 3, Last Minute Healthy Eating Prep. And hey, if you enjoyed the show today, share it with your friends. We have a message to spread. Share it. We all can benefit from the things that we talked about today. I want you to do the best you can with your health, and let's keep this health revolution going. Check me out on my website, www.drmarkgomez.com. See you next week. Peace out.